Thank you, Dr. Moite. Honorable Ministers, Regional Directors of WHO, African Regional Office, and UNFPA Eastern and Southern Africa, members of the Diplomatic Corps and Head of International Organizations, representatives of government and civil society institutions, ladies and gentlemen, good afternoon. Allow me to start by expressing how honored I am to be part of this important session today as we come together as members of government and civil society to advance the question of adolescent health as one key component of equity and universal health coverage. Indeed, this special event for the promotion of our adolescents' health towards the achievement of SDGs allows us to reflect on how much we can do, how much we must do to capitalize on the remaining barely 13 years we have left to meet this SDG 3. Distinguished audience, allow me to take a moment here to also add my voice to that of my fellow Rwandan people to warmly welcome you, distinguished guests and participants, to this first WHO Africa Health Forum. We hope your stay in our beloved country will be a pleasant one, and we'll encourage you to come back to discover more. Today's special event allows us to learn more about the Adolescent Health Flagship Program, which will be used to monitor the impact on health development in the region by the African Regional Office of the WHO through adequate mainstreaming with national adolescent health priorities. This first Africa Health Forum therefore provides us with another valuable opportunity as citizens of Africa, a continent with such a large youth demographic group, to respond to the pressing call to never cease exploring new ideas and approaches to improve the health of our youth. Indeed, we know the urgency of the situation on the ground. We need to establish well-performing systems which rely on strong institutions with well-trained personnel in order to help counter a variety of challenges, increasing access to reliable health information and education for healthier lifestyles. As we are all aware, putting in place mechanisms promoting and securing the holistic well-being of our youth is vital if we want them to fulfill their potential and see them grow into thriving members of society and future leaders. Honorable ladies and gentlemen, the health of all Rwandans is a priority to us all. For the past years, Rwandan health initiatives have been building on the milestones achieved over the years, thanks to the government's commitment to fulfill key health targets, such as the strengthening of universal health coverage, currently nearing 85% of the population, and meeting all the 3 health-related MDGs, namely MDG 4 for reducing child mortality, MDG 5 for increasing maternal health, and MDG 6 for combating HIV and AIDS, malaria, and other diseases. To promote health living, Rwanda used innovative methods to help the different members of our communities exercise their right to access health services while providing alternatives to match their current situations and needs. These methods include the support of peer educators, who are volunteers who play such a crucial role in increasing access to sexual and reproductive health information for all, while also contributing to prevention and treatment efforts of HIV and AIDS. But also the use of a network of 45,000 trained community health workers who are registered through the Ministry of Health and provide primary care to support health institutions by counseling members at the community level to seek the right medical treatment in a timely manner. In accordance with the key global and regional initiatives, the government adopted adolescent-focused policies and the National 12-Year Basic Education for All, with the integration last year of the comprehensive sexual and reproductive education in school curriculums. Indeed, this comprehensive curriculum allows us to reach an even higher number of young people while with life-saving information, while empowering teachers through trainings in how to include its related topics in general studies. Ladies and gentlemen, it's with the same spirit of finding solutions concerning health issues that my foundation, the Imbuto Foundation, has aligned with the government priorities and has put at the core of its mission the promotion of a healthy population. As such, the foundation has continuously placed at its forefront the health of our people, with a special focus on our youth by implementing innovative health programs for more than 15 years. For instance, last year, the foundation partnered with the UNFPA and UK Aid to launch the Innovation Accelerator project, which challenged young people to find sustainable business-driven solutions to sexual reproductive health issues they saw in their communities. Projects such as the Accelerator is relevant to our current realities as it empowers our young people to take charge of their own health by feeling responsible for finding creative, youth-friendly solutions for issues with such great impact on their future. The past years have also been a time to focus on the holistic development of 10 to 12-year-old girls living rural areas through the program that we call the 12+. This nationwide health program, which is coordinated through the Ministry of Health with the support of DFID, is implemented by Imbuto Foundation in 10 districts and focuses on empowering these young girls with educational and health information pertinent to that critical pre-teenage years. Through weekly mentorship sessions held in safe spaces, these young girls interact with a young mentor who discusses with them about their sexual reproductive health, developing a culture of savings, entrepreneurship, and the importance of completing one's education. It involves parents and the community through what we call parent-adolescent communication forums, which teach families to talk more openly about these sensitive topics with the support of a clearly explained manual. Distinguished guests, allow me to also share another approach realized together with the support of my sisters through the OAFLA, the Organization of African First Ladies Against HIV and AIDS. In 2016, the Continental All-In campaign, initiated by OAFLA in partnership with the Ministry of Health, was launched in Rwanda. This campaign was created to address HIV and AIDS epidemic among the youth, with programs that aim at the elimination of mother-to-child transmission, the EMTCT, of the virus but also fighting stigma and dismantling stereotypes associated with the disease. Through the All-In campaign, we also saw the youth playing an active role in preserving their well-being by taking full advantage of activities such as VCT and voluntary medical male circumcision in an effort to reduce new HIV infections among adolescents by the year 2020 and the AIDS epidemic for all by 2030. It's our hope that through time, such campaigns will further contribute to increase awareness and community mobilization to help our youth continue to make better informed decisions for the sake of their health and that of the future generations. Ladies and gentlemen, as I conclude my remarks, I would like to take this opportunity to thank once more all those who have contributed to the realization of this special WHO event, highlighting once more the importance of advancing the question of adolescent health, while emphasizing the power of public and private partnerships to achieve the Sustainable Development Goal 3 for good health and well-being. This occasion is a true evidence that if we all join hands, we can overcome health and developmental challenges affecting our countries, our continent, and beyond. Let us continue to empower our young generations by opening up to them about the lessons we learned over the years, but also by making sure they continue benefiting from what we did not have growing up. Whether it be an education system that include comprehensive sexual and reproductive health, information, the implementation of efficient and intuitive youth-friendly services via health institutions, but most importantly, by overcoming our uneasiness towards some aspect of our adolescent health, because ultimately we owe it to them to give them all the tools they need to fully thrive. I thank you for your kind attention and wish you all fruitful deliberation.